Welcome back for the second part of this lecture today on psychopathology. We're going to talk about, body image. This is on page 368 and 369 of your text. It's estimated, we're told, that 1% of young American women suffer from anorexia nervosa, over associating control, whether that's psychological control or social control, with food intake. And that might extend to something like calorie counting, self-imposed food limiting, self-imposed starvation. And there's a sense that if you're able to do these things, then it's not just a symbolic act of control, but there's also true control that's being achieved and claimed within life. 2.3% of young American women suffer from bulimia nervosa. Food binges followed by purges. Purges could involve excessive exercises, spending, way too much time at the gym. Laxatives, just being used to sort of purge, or, of course, vomiting. Both of these disorders can be fatal, there can be serious health consequences to these. So, my recommendation to practitioners who are, working with a client who may have an active eating disorder is to really make sure that your client is in recent contact with their primary care professional, so they're being checked out physically, because people can get very depleted of, nutrients, and, you can sort of run into neurological dysfunctions and ailments, as a side effect of eating disorders. And, of course, this could be fatal, not to mention present cognitive deficits to someone trying to live their life and trying to do work in therapy. Research by Fairburn and Brownell from 2002 and Smolik and Thompson from 2000 suggests that these rates may be particularly high among college students. A little bit more on body image. Research on female body image also found that women who view TV and magazine ads featuring ultra-thin models are more likely to experience dissatisfaction with their own bodies. This is compared to women who viewed neutral materials that, didn't have ultra-thin models, essentially being glorified, being models. And that this is less harmful to people, or that it's particularly harmful to people who I'm going to say uncritically view these images of ultra-thin women. Does this fit with your experience? Does this not fit with your experience? Start thinking about this, because we'll be coming back to this topic for the discussion board post this week, for one of the posts. This could be a good time if you feel like taking, another break even after just starting this. This movie, Bigger, Stronger, Faster, it is on Netflix. I will try to post up a low-resolution free version of the movie if I can. But this is a really great movie that looks at body image issues in men, which is, of course, a really under-recognized, under-studied mental disorder, mental issue. And this focuses on steroid use and bodybuilding. So, we can observe some themes here of strength, of trying to claim strength, of control, trying to claim control, themes of power, loneliness, alienation, and desire for something. Anxiety disorders We mentioned how this was, one of the major topics, major areas of classification within the DSM-5. This includes diagnoses like PTSD, post-traumatic stress disorder, obsessive compulsive disorder, panic disorder, generalized anxiety disorder. Yes, it's been found that CBT has been found to helpfully treat these disorders. It's also been found that client-centered therapy, which is the model of therapy attributed to Carl Rogers, that focuses on self-actualization and of being able to move past external standards of worth. So we could see how that relates to this issue here. Client-centered therapy, as well as CBT, have been very effective in treating anxiety disorders. On page 353, we look at social anxiety specifically, which is also known as social phobia. This is interesting that it's considered a phobia, okay, a type of a phobia. This involves intense feelings of discomfort in situations that involve public scrutiny. When surveyed about about what they fear about public presentations, individuals with social anxiety reported that they feared going blank, saying something foolish, and being able to continue, especially, freezing up is a particular fear. We might ask if social media influences this phenomena, if other aspects of modern life influence this or feed into this as well. Something about comparing ourselves to others, and maybe having ideas about who should be who and how we should talk, but these norms have been disseminated not through interactions but through impersonal channels of very voyeuristic and judgmental dialogues, and just through advertising imagery. The stuff, interestingly, right, might touch on human experiences or might even represent what humans strive for, but can have very little to do, these expectations or these pseudo norms with what people actually really will talk to each other, say, if they sit down and talk to each other in a comfortable way. In 356, we talk about loneliness. This is something that's a more general human experience, and again, we would want to be careful. If someone is lonely, we don't just want to say that they have a mental illness just like that. But a lot of these issues do relate to loneliness, a feeling of deprivation about existing social relationships. We could ask, what could we change about society that might decrease loneliness? Again, I'm saying this because I want us to not just look at how individuals might need help or be, in the grips of some congealed dysfunction, but also how this might be largely environmental in some cases. The authors of our text explain that loneliness is a feeling of deprivation about existing social relations, meaning like people want more of something, they want more intimacy, they want more collective meaning, they might want more relational substance, they might crave more contact and content, maybe even a challenge or something like that, stimulation from other people specifically. This is a human view, a human drive that's multifaceted and is very connected with psychological distress and social conditions as well. Revisiting the idea of critical thinking, with this being a very important component of mental health. One benefit of psychotherapy is that it allows individuals to put their feelings into words. This means that even though social pressures might inspire feelings of inferiority and I guess therefore the need to silence oneself, talking about these feelings can highlight, they can activate, and they can deconstruct the assumptions that we were operating under. It's an interesting thing that people often find in therapy, that when they talk about why they feel a certain way, they'll realize that those weren't really good reasons. You know, that none, and just to be clear, this isn't to downplay anyone's experience or to say people just need to get over their problems, but it's to say that the internal pressures are sometimes greater than the external pressures. In particular, this is a point that Freud and the psychodynamic model will help us understand better. This idea that there is an internal standard of worth that has linguistic content, right? Certain should statements that have been internalized, certain ideals that might be strived for very strongly and with a lot of passion, but that may actually be toxic in some way, or they may just simply be unreasonable, or even if they are reasonable or healthy, not toxic, just to use that metaphor if we may, that they're being applied in a way that's out of balance or unrealistic or impractical. Or sometimes people might feel that they were to blame simply because they felt bad, or to blame simply because someone else felt bad. So this is where talking out your problems is a form of critical thinking, or at least it can be, in the way that it asks us what assumptions we're just going along with. And if we put in that extra bit of effort to really think about it and label what's going on, we might find that we were kind of stereotyping ourselves. In this way, critical thinking could be said to center us in terms of our own integrity and our own knowledge, not someone else's knowledge, not what we think we ought to be, not what we think we ought to be able to do, but what we really can do. And so it returns ourself to our own experience, our own historically and socially conditioned memories, aptitudes, preferences, and can be much more conducive to stability and fulfillment. This does take a lot of work, right? It does take the need to look at something that's uncomfortable. And as far as American society might have come in terms of pushing people to go to therapy, if you need to go to therapy, there still are a lot of other messages that might come from advertising or might just come from ruling institutions that say, just focus on what you need to get done. Don't get hung up on the details. Don't get hung up on a self-fulfilling prophecy. And yeah, it does take a lot of judgment not to just spend too much attention ruminating and sifting through problems, which is a common criticism of psychoanalysis, and for good reason, and represents something that's very different about psychoanalysis from CBT or even mindfulness and ACT. That something about the work of self-exploration can become addicting and can become impractical when maybe what someone just needs is to go out and do something to make their life better. All these are important things to be sifted through in therapy, and part of why it's important to work with a professional who has that honed judgment. Immanuel Kant, who was quite an inspiration to Adorno, in particular Adorno's theory of human nature and how difficult it can be to represent human nature, how necessary it might be to study art and study what humans identify with or what humans create from deep places, art that is, how important those frameworks are for understanding human nature without just stereotyping people or reiterating, stamping out one after another on a large scale, mass-produced, certain standards of worth or certain desires for a group. identity. Right? Even therapists might do that. So what I'm saying here just is that, critical thinking needs to happen in life. It needs to happen in therapy as well. And I think there is something to be said for like the real life side of problems too, of, just get out and do something that'll make yourself feel good, or, maybe try to learn about some art that seems to speak to you. It may teach you something about yourself. It may give you a better frame for looking at things. A lot of this was said by Kant and was very influential to Adorno. Kant also said that all feelings and intuitions are potential objects for the human intellect. What he means by this is that when something is going on inside of us, physiologically, that is, that it's at least possible. Remember, he just says it's a potential object for the intellect, but it's at least possible that we might be able to better recognize, what is going on for us in that moment, and then actually learn something about ourselves and about our world, rather than just be stuck in our feelings. So, as influential as Kant may have been, not just to continental philosophy, but to psychotherapy as well, with his idea that there's like an unknown aspect to nature, and yet we can still find these words and concepts that are better fits, and there are, is a certain movement that critical thinking can take in terms of moving us to better, more adequate concepts. These things were very influential to therapy, and, present something that's a more disinterested view of life and of emotion. And I think that is a little strange, to some therapists. It certainly has a lot in common with CBT. It has less in common with mindfulness, I might say, speaking really broadly here. A little bit of a review, though, just for maybe folks who don't remember what, is this critical thinking thing that we talked about. It's the clear and rational thinking that involves the critique of information. So it's actually a way of looking at what we consider to be evidence, or what we consider to be valid knowledge, and saying, well, does this really say what I think it does? Remember what John Dewey said, that this allows us to have a more personal relationship with what's considered to be knowledge, and then therefore it's going to be more practical because it's a better fit personally. So as we get into the discussion board, we can start to dive into this. In that, critical thinking might be an important way to respond to social messages about body image or achievement, or just performance in general, about the need to prove oneself in general. And this isn't to say that it's not nice when people can win each other's trust or admiration or prove oneself to each other, but it can't be emphasized too much, right? It can be destabilizing, or it can pull the gaze too much on the imagined heart of someone else, someone that you can't really account for that much within your own experience and expectations, or personal integrity. Even we can have empathy, we can think about these things, but right, the common saying that if one loses touch with one's own feelings about helping others, then they may find that they're too unstable to help others. It's nice to be able to talk about some of these topics today with you all. I look forward to reading what you have to say on the Canvas discussion board, and as always, don't hesitate to reach out to me via email. That's what I'm here for. I want to be able to help you if you're having trouble with some of these concepts, or if you're maybe feeling hung up on some of the work, to help you troubleshoot that. Hope you all have a good week and take care. Thanks again.